Hello everyone, welcome back to my channel. Today I will be discussing about how to get a clear cornea after phacoemulsification of a brown cataract. I will be discussing each factor one by one as the surgery proceeds further.
So the basic concept is that we want to reduce the trauma to the corneal endothelium, which is due to the either ultrasound energy or heat dissipated in the anterior chamber. As you can see in the video, cracking of the nucleus should be within the capsular bag, and I am trying to do the same with the help of direct chop technique. Deeper plane of the emulsification will cause less transmission of the ultrasound energy up to the corneal endothelium. In this video, you can appreciate that the nucleus is divided into multiple fragments within the bag only. One more supplementary tip for the hard cataract is that you need to have full thickness crack in the first go itself. Well, let's proceed with the tip number 2, which is judicious use of viscoelastics. It should be put in such a way that the nuclear pieces are pushed backward and coating of the endothelium occurs. I mean to say that the chamber should be adequately tight. I prefer to put OVD from the side port because the entry and exit from the main port of the phaco probe creates a rebound effect of the pupil, which eventually lead to constriction of the pupil at the end of the surgery. Now, tip number 3. After achieving multiple nuclear pieces, how to emulsify and aspirate them. So each piece is taken out of the capsular bag one by one and engulf them in the central 3 mm zone at the pupillary plane, which is now a safer zone. If you aspirate pieces above the pupillary plane, visco delivery have to be replenished frequently. Now, the tip number 4. When to put visco. Whenever you feel that the movement in the anterior chamber is slightly vigorous, a movement in the anterior chamber means the micro movement of the iris tissue, fluctuation of the posterior capsule, and nuclear pieces behavior. These are the subtle signs which tells about the visco need in the anterior chamber. Now, let's proceed with the tip number 4. Don't be greedy during last piece emulsification. This is one of the crucial tip to avoid the PC rent. Either you come out and put visco or keep your probe at the center and put the visco from the side port. Tip number 5. Emulsification and aspiration of the thick epinuclear sheet and the cortex. So we tend to ignore the energy used during the emulsification of the epinuclear sheet. So it should be done under the OVD, as you can see in this video. So these are the 5 tips which are very helpful during emulsification of the hard cataract. After emulsification of the cataract, I could see the fundal glow, but it seems to be blue. This is blue because of the percolation of trypan blue dye from the weak zonules. The dye is generally safe, and it disappears after day 1 from the posterior chamber. Uh, and it does not show any side effect, but have implications during intraoperative management of the cortex, as the view of the cortical fiber is not very clear as the normal usual case, but it is manageable. So irrigation and aspiration should be very slow. As a routine case, now it is the time to implant the IOL into the capsular bag. So I usually do hydroimplantation of the IOL, and here we go with the IOL injection. And now the visco has been taken out from the anterior chamber and the wounds are sealed. Both the side ports and main ports are hydrated, and some conjunctival gentadeka is given. And this is the final post-operative picture on day 1, post-op day 1. You can see the cornea is clear, a small air bubble is lying superiorly, and the patient seems to be very fine. Thank you so much for watching the video.